Hello friends, in this series of X-ray, we will discuss about our sixth lecture. In this lecture, we will discuss about the X-ray finding of diaphragm, thoracic case, and important mediastinum. So, in diaphragm, we will see about eventration, paralysis of diaphragm. It may be idiopathic or it may be iatrogenic. So, if you see this X-ray, you can see there is elevation of left side of diaphragm. So elevation of diaphragm, it means either it is eventation or paralysis of diaphragm because of phrenic nerve palsy. So what is eventation? Eventation is just thinning of muscle. So whenever there is thinning of diaphragmatic muscle and because of intra-abdominal pressure, diaphragm goes up. So there will be paradoxical movement on fluoroscopy, and the eventation may be diffuse, which involve whole hemidiaphragm, or it may be localized. If it is localized, you can see there is focal bulge of diaphragm. So we will see other X-ray. So this is eventation of diaphragm because of thinning of diaphragmatic muscle. So this X-ray, you can see this elevation of right side of diaphragm. But remember, radiologically, it is very difficult to differentiate this eventation of diaphragm from subpulmonic effusion, means this collection of fluid between diaphragmatic base and the pleura, and raised diaphragm due to liver abscess. Radiologically, it is difficult, but still we can have an idea. So in subpulmonic effusion, patient will have rheumatic chest pain and diaphragm usually flat, or you can see this convexity shift towards lateral side. So this was explained in my lecture 3 also. So whenever there is convexity shift towards lateral side, you can think of subpulmonic effusion. And how to diagnose? We can diagnose by our decubitus X-ray or ultrasound thorax. While eventation, patient will have shortness of breath on lying down position. Why? Whenever there is a lying down position, diaphragm will go up, and you can see convexity is same as normal diaphragm. And how to diagnose? By fluoroscopy and ultrasound. So this is how we can differentiate clinically as well as radiologically. But radiologically only it is differentiation is difficult. So can you see the finding in this X-ray? So in this X-ray, you can see this focal bulge of right side of diaphragm. So this is eventation of diaphragm, which is localized. In this X-ray, you can see there is elevation of left side of diaphragm. So it looks like a diaphragmatic palsy or eventation of diaphragm. So by clinical history only, we can say this is diaphragmatic problem because of trauma. Radiologically, we cannot differentiate. So this is clinical diagnosis only. Can you see this X-ray? In this X-ray, there is elevation of right side of diaphragm. So it looks like a eventation of diaphragm, but we cannot differentiate between palsy and eventation. So this is example of hemidiaphragmatic paralysis due to phrenic nerve palsy. This patient was having CA lung, which was causing phrenic nerve palsy. Can you see this X-ray? So right side is normal, but in left side you can see there is multiple ear fluid column. Can you see this ear? Multiple columns. Okay. One thing you can notice, there is no contour of diaphragm, and below diaphragm there is no fundal shadow. So this was case of diaphragmatic hernia on left side. So these shadows was colon, intestine you can see multiple ear fluid level. So this was case of diaphragmatic hernia. So please, whenever you find multiple ear fluid level, don't insert chest tube in thinking that this patient is case of pneumothorax. So this is not pneumothorax, this is not pneumothorax, this is diaphragmatic hernia, and that this is a large intestine. So we have to differentiate from multiple hydropneumothorax clinically as well as CT scan. Same patient, if you see CT scan, so this is liver, and in left side, if you see carefully, this is diaphragm. See, this is rupture of diaphragm, and by this rupture, this intestine is going from abdomen to thorax. This is colon. This is large intestine, and this is diaphragmatic defect. So this was case of traumatic diaphragmatic hernia on left side. Can you see this X-ray? So in this X-ray, you can see there is slight air column below the diaphragm. Can you see this slit like opacity, black opacity? It means there is air below the diaphragm. So this is case of pneumoperitoneum, like pneumothorax. The pneumoperitoneum, there is air in the peritoneal cavity. So you will find air under diaphragm. So this is important sign, ciliarity sign. So what is that? When intestine is interposed between liver and hemidiaphragm. Here is liver and here is diaphragm. So you can see there is small intestine between these two structures. So this is ciliarity sign. Okay. So gas in this position may be interpreted as true pneumoperitoneum, but this is not pneumoperitoneum. This is intestinal loop, which gives this black opacity like a air. This is ciliarity sign. So after diaphragm, let's see thoracic case. In thoracic case, we will see about our rib cage and our subcutaneous tissue. So can you see this X-ray? In this X-ray, so you can see carefully, this is soft tissues outside the chest, and you can see there's penetration of air because air gives black shadow, hyperlucent. This is air in subcutaneous tissue. So this is case of subcutaneous emphysema, or also called surgical emphysema. So this is case of traumatic pneumothorax which causing subcutaneous emphysema. Yeah, this is subcutaneous emphysema. You can see there is chest tube. You can appreciate chest tube. So because of pneumothorax, chest tube was inserted, and after that, patient developed massive subcutaneous emphysema. In CT scan, you can see this is pneumothorax, black shadow, pneumothorax, and you can see this is air in the subcutaneous tissue and muscles. Can you see? This is. So this is case of subcutaneous emphysema. Now see this X-ray carefully. Okay. If you see this X-ray carefully, you can find there is osteolytic lesion. So this is same patient X-ray. So you can see there is lysis of rib. So this is case of rib erosion due to multiple myeloma. So whenever you get X-ray, please focus on other area also, like ribs, subcutaneous tissue, and trachea. We should not focus only on parenchyma, but we have to focus in other things also. So if you see carefully, you can find rib erosion, and this case was multiple myeloma. So if you see carefully this X-ray, can you find fracture rib? Yes, you can find. So I'll show you in this X-ray. Yes, this is same patient X-ray. I have zoomed this X-ray, and you can see there is discontinuation of this rib. Can you see? Can you see this breaking this area? This is fracture of ribs, right side rib. Can you appreciate fracture of ribs on right side because of trauma? So this was kyphoscoliosis. So kyphoscoliosis, when there is bending, lateral bending on vertebral column. If lateral bending, this is scoliosis. If there is anterior-posterior bending, this is kyphosis. So usually patient used to have both things at a time. That is kyphosis and scoliosis. So collectively we called as kyphoscoliosis. So in this CT scan, we can see there is chest wall deformity. Can you see chest wall deformity? This is kyphoscoliosis. So this is beautiful X-ray. Can you see this vertebral column going laterally? See this round. Can you see this round? So this is severe kyphoscoliosis. And what will cause? It will cause severe restrictive lung disease because patient is not able to inflate and deflate his lung. This is kyphoscoliosis. Now, after diaphragm, after chest wall, we move to mediastinum. So, what is mediastinum? This is intrathoracic region outside pleural sac in the center of chest. So, between two lung parenchyma, the structure is mediastinum. Okay. So, mediastinum, if we see lateral X-ray, and we have read in our MBBS days, mediastinum is three compartment: anterior compartment, middle compartment, and posterior compartment. So how to divide this mediastinum into three compartments? So if you see this X-ray, this is trachea, anterior trachea and posterior esophagus. So the anterior wall of trachea, we have to draw line, and we have to draw from posterior part of heart. So posterior part of heart, this is heart, posterior part of heart, anterior part of trachea. So this is anterior mediastinum. Okay, middle mediastinum. So we take one line just posterior to esophagus and vertebral column 1 centimeter behind the anterior margin of vertebral column. So this is 1 centimeter. This is anterior border of vertebral column 1 centimeter posteriorly. Draw a line. So this is middle mediastinum, this is posterior mediastinum, this is anterior mediastinum. So if you see content of mediastinum, very important. So anterior mediastinum, we can see this is heart. So where is our heart is situated? Anterior mediastinum. Don't forget. Okay. Then this is substernal space or retrosternal space, the area behind the sternum, that is anterior mediastinum. Then this is heart. This is ascending aorta, goes like this, and going to posterior, middle and posterior. So what is there in anterior mediastinum? Retrosternal area, heart, that is left ventricle, right ventricle, and ascending aorta. So what are the disease? If there is mass or soft tissue in the anterior mediastinum, the probable diagnosis is thymic mass, because thymus is the anterior side, thyroid mass, which is extending through sternum to anterior mediastinum, lymphoma, very important. Lymphoma can be there in any compartment, and some teratodermoid tumor, that is germ cell tumor. These tumor are there in anterior mediastinum. Okay. If we see medial mediastinum, there are few but vital structures like trachea, esophagus, superior vena cava, and arch of aorta. So if you see carefully, here it is heart, and it is going ascending aorta, here taking a arch, and descending aorta goes posterior side. The middle part, what is there? Arch of aorta and superior vena cava. So what are the abnormality can be there? Enlarged lymph node, most commonly lymphoma, aortic aneurysm, because arch aorta is there in middle mediastinum, and esophageal mass, because esophagus is there. What about posterior mediastinum? Posterior mediastinum is descending aorta, vertebral bodies, this is vertebral bodies, and nerves. But abnormality could be there, paravertebral mass. If there is mass here, we can find in posterior mediastinum, abscess, neurogenic tumor, and lymph node is everywhere. So whenever lymph node is there, it may cause lymphoma. So lymphoma can be there in any compartment, any mediastinum compartment. Okay. So if you see this X-ray very carefully, so you can see this is the opacity. Okay. So by seeing this X-ray, Can you tell this opacity where it is? It is whether it is anterior mediastinum, middle mediastinum, and posterior mediastinum. Okay. So to understand the location of this opacity, we have to understand Silhouette sign. So what is Silhouette sign? Silhouette sign is if two opacities are there and which have same content, either they are liquid or soft tissue, and they are there together. So you cannot find border to differentiate between these two opacity. That is Silhouette sign. Okay. So if we see carefully in this X-ray, so this is opacity, and you cannot find left hard border. So this Silhouette of left hard border. And I told you heart is there in which compartment? This is anterior mediastinum. Heart is there in anterior mediastinum. So this is anterior mediastinal opacity. If you see lateral X-ray, you can see this is there in anterior compartment. Another thing is hilum overlay sign. What is hilum overlay sign? So hilum overlay sign is if you see this opacity carefully, you can see hilar vessels beneath this opacity. Behind this opacity, we can see hilar opacity. So hilar vessels, sorry, hilar vessels. So if you can see hilar vessels either anterior to mass or posterior to mass, it means opacity either it is there in anterior mediastinum or posterior mediastinum. If you are not finding these hilar vessels, it means opacity is sloughing middle mediastinum. Okay, so we can see vessels clearly. It means our hilum overlay sign is positive. It means opacity either anterior mediastinum or posterior mediastinum. And how to decide if anterior posterior? Because it is sloughing left cardiac border, and we know cardiac border means anterior mediastinum. So this is anterior mediastinal opacity. So can you see this opacity? So again, this is obscuring right heart border. So this is anterior mediastinum. Another thing is you can see hilar vessels clearly. See, this is hilar vessels. So if you find hilar vessels intact and they sell out of right heart border, the opacity is in anterior mediastinum. Another thing is to differentiate between lung mass and mediastinal mass. So lung mass makes angle with this border, hilar border is acute angle. Okay, while mediastinal opacity make obtuse angle. Okay, so this is mediastinal opacity. So this is hilar border. This is hilar border. If you see this angle, can you see this angle? This is obtuse angle more than 90. If it is less than 90, probably we are dealing with lung mass, not mediastinal mass. Okay, so three things are there to say anti-mediastinal mass. This is sloughing right heart border, hilum overlay sign is positive, and other thing is the angle between this mass and this border, mediastinal border is obtuse more than 90. So this is anterior mediastinal opacity. The diagnosis probably lymphoma. In CT scan also you can see this is anterior mediastinal mass. So see carefully this opacity. So this is diffuse opacity on left side. Okay, again you can see hilar vessels and left heart border we cannot see, we cannot appreciate. So this is anterior mediastinal opacity. If you do CT scan, you can see the opacity same as blood. So this is case of hematoma, anterior mediastinal hematoma. Now see this X-ray. So this is the abnormality. Can you see abnormality? So can you see vessels, Haller vessels? In right side we can see, but left side we cannot see. Okay, so this is middle mediastinal mass. And one more thing we can appreciate, that this opacity is obscuring arch of aorta. And I told you arch of aorta is there in middle mediastinum. So this is middle mediastinum mass. Why? Because hilum overlay sign is absent. We cannot appreciate vessels, and it is sloughing that arch of aorta. This is mediastinal mass. Same thing here. You can see this is large mediastinal mass. Okay, we cannot appreciate arch of aorta. Okay, so this is middle mediastinal mass. Now see this opacity carefully. So this is opacity. Okay, so this is not eventation of diaphragm, because we can see diaphragm. We can appreciate diaphragm medial part, and this is lateral part. So this is opacity. Now you can see that this mass is not silhouetting right cardiac border. Right cardiac border we can appreciate. It is not silhouetting diaphragm. And if we see carefully, this is anterior to right heart border. See, this is anterior. So anterior to right heart border, and this X-ray is PA view, posterior anterior view. So whatever you see first, you will appreciate in posterior part, because rays are going from posterior to anterior. So posterior, you are seeing first this mass. So this is posterior mediastinal. Okay, any doubt? Now same thing you can see on left side. Left side, if you see carefully, this is anterior to this heart border. Okay, so this is PA view. So PA view, you are appreciating opacity first. So this is posterior mediastinal mass. This is not medial mediastinum, middle mediastinum, because it is not obscuring heart border. This is posterior mediastinal mass. This is lateral X-ray, and this is CT scan. Lateral X-ray you can see posterior compartment, and CT scan posterior mediastinal. Okay. So if you find diffuse mediastinal widening, then probably we are dealing with either large mass lymphoma, which is extending from top to bottom, or there is mediastinal hemorrhage or mediastinitis. Okay, so you can see this is diffuse mediastinal widening. So this was case of acute mediastinitis. Now this X-ray, if you see carefully, there's diffuse mediastinal widening. Okay, but if you see carefully, this mediastinal widening is not obscuring any structure. Okay, because this is radiolucent, completely radiolucent. If we see CT scan, this is radiolucent things. This is fat. See, this is lower part. This is fat. So this is mediastinal fat, which is giving diffuse mediastinal wide. Okay, clear? Now this is quiz. So I'll show you three images. I'll ask you question, and you have to answer. Answer you have to write in your comment box. And in next lecture, I will discuss all these three cases. So let's start. This is our first case. So in this case, what are you seeing on left side? What are the finding, and what is the probable diagnosis? So see carefully and write answer in your comment box. In this X-ray, where is the location of this mass, and what are the right side Haller region? Haller region, what is the sign you can appreciate? And case number 3 is, what is the name of this sign seen in X-ray? So please write answer in comment box. In next lecture, I will discuss answer of these cases. So friends, if you like this lecture, please share with your friends. And if you're not subscribed to this channel, please subscribe. And on X-ray, this is my sixth lecture. All five lecture I have uploaded on YouTube. So to understand better, please go through it. See you in next class with new lecture. Thank you very much.